Hi there, I'm Harrison.
I'm Brooke. It's nice
Good
to meet you.
too. Um, so I'll be your personal trainer, and to start out, we're going to do a health history questionnaire here. So
Okay.
what we're going to do here is these are a series of questions here that'll ask you about your medical history, exercise history, and so on. And let me know if you have any questions here. I'm more than happy to answer them.
Okay. Okay. I think I finished it.
Thank you. And I'll take care of this bottom part after the interview.
Okay.
So next here I have a PARQ, which stands for Physical Activity Readiness Questionnaire, and this is some more continued questions about your medical history and signs and symptoms.
Okay.
Once again, let me know if you have any questions. I'll be more than happy to answer them for you.
Okay.
Okay. Since you answered no to all these questions, we should be all clear, so I do not have to send you to a physician. And then down here, I will ask you for your signature and name. This is just to say that we're all set here, that I don't need to send you to a physician once again, and we should be all good to go. Once again, continue to ask me questions if you need to.
Okay.
All right, thank you. Next, we get into a little bit more of the nitty-gritty part here. This is
Okay.
the informed consent. Here's a copy for you,
Thank
and I
you.
also have a copy that I'll explain to you, so we'll go ahead and do that. So first off, we have the purpose and explanation for the test. So the purpose of the fitness assessment is to determine like baseline fitness levels so we can get you prescribed for individualized fitness to meet your needs and goals. During this assessment, we'll do several exercise tests. It'll assess your like body composition, cardiovascular fitness, muscular strength and endurance, and your flexibility. So first, we have our body composition, which it'll be analyzed using skin fold tests, which basically will take part of your skin and then a couple times each, and then we'll use these little pinchers here to assess your overall body fat in that part of the body. And once again, this is a test where you don't have to remove your shirt if you do not want to. This can be easily done with your shirt on. Next, we have our cardiovascular fitness, which will be assessed via a graded exercise test on the ergometer, which it'll consist of 3-minute stages, three 3-minute stages actually, where we're going to assess your heart rate a couple times, we'll assess your blood pressure once, and then get your rate of perceived exertion. And this is all exertion to assess your VO2 max levels. For muscular strength and endurance, what we're going to do is this will be a few tests here, and this will require you to do some exercises like some push-ups, some bench presses, some leg presses, just to name a few of them. And lastly, we have a flexibility test where we're going to do a classic sit and reach test to assess your flexibility, and you can stop the test anytime you feel like fatigue or any type of discomfort. So basically that's all there, and once again you can also let me know if anything makes you uncomfortable here, and we'll do the best we can to accommodate you, and then we'll stop if we need to.
Okay.
Some possible risks and discomfort. As with any exercise, there is always the risk of certain changes occurring during the tests, which includes like changing blood pressure. It can include fainting, irregular heart rhythm, and of course, in rare instances, heart attack, stroke, or death. But once again, those are rare instances. Which every effort will be made to minimize those risks, and then which we'll get to this part in a minute, but like I said, it's you know you better than I know you, so you gotta let me know if you need to stop or if you need to take it down or anything like that.
Okay.
So going right into that, so basically it is your responsibility to let me know if you're experiencing any symptoms like shortness of breath, with low level physical activity, any sort of pain, pressure, tightness, or heaviness in your chest, your neck, jaw, back, or arms, which could affect the safety of your test. And you're responsible for disclosing medical history as well as symptoms that may occur during the test, and you are also expected to report to the testing staff all medications, including non-prescription, that you've taken recently before the test, and in particular taken on that day, because that can be very important for our tests. Some benefits to be expected. The results obtained from this test will quantify your exercise capacity, and which may be helpful in evaluating what type of physical activities are appropriate and safe for your level of exercise. Any questions about the procedures used during the test or the results of the test are all strongly encouraged. If you have any sort of questions or concerns, please ask me for further explanation, and like I said, I'll be more than happy to explain them to you. And then lastly, this is the voluntary consent. This just says that you've read through everything and you understand what's going on and all that stuff, and you're giving us permission to perform this test voluntarily, and you also understand by signing that you may stop at any point if you so desire. Thank you.
There you go.
Alright. And lastly, here's a sheet. Here's a sheet to fill out just to get to know you better as a client.
Okay.
This will include a few medical questions, but also what your questions on what you're interested in exercise-wise and stuff like that. And once again, please feel free to ask me any questions if you need to.
Okay.
More than happy to help you out.
Okay, I think I got everything filled out.
All right. And that's everything. I greatly look forward to working with
I
you.
do too.
Great to meet you.
Nice to meet you too.